Attention please. Cinder Collie to the nurse's station. Cinder Collie to the nurse's station. Thank you.
Guys! This weekend stuff! God, it was such a long weekend!
Stimbabby. Much love, Cinder.
Diffuse coming in with the tier 1 sub for freaking 9 months, dude! Diffuse! Look at that founder badge. Stream baby. If we're having a stream baby, you know what that means. You gotta be the daddy. You know that, right? Dude, Rex
Cinder
Collie.
hug.
Rex Collie also coming in with the 9 freaking months. 2 stream babies in 1 stream? Guys, we're gonna have to get Maury involved. Who's the father? Is it you, Diffuse? Or is it you, Rex? Who's the father? The DNA test will show. You guys ever watch that show? You guys ever watch Maury? Man, daytime television. What a piece of crap. Holy crap, Catnip coming with the follow. Thanks. Welcome to the Floppy Flock. Welcome in. Ace Rail. Thanks for the follow. Welcome to the Floppy Flock. Welcome in, guys. Dude, Ace. Oh my god. Guys, please. Ace Rail coming up to tier 1 sub for 1 freaking month. Hold on, I'll finish that in a second. Oh god, choked on coffee. Ace Rail coming up to tier 1 sub for 1 freaking month. Dude, we got a new subscription to Collie Care. Ace Rail, enjoy your new emotes. Guys, spam the flops. Ace Rail, you're covered under Collie Care from the flops to the beans. I got you covered. DJ Dragon coming up to tier 1 sub for 8 freaking months. Dude, DJ, almost a stream baby. No, we're not having triplets today. No triplets, just twins. Dragon's Bane. Dude, Dragon's Bane coming up to tier 1 sub for 8 freaking months as well. Guys, seriously, holy crap. This must have been right around when I started streaming, like halfway through the month. Damn. Oh my god. Guys, Jesus. Dragon's Bane coming with the tier 1 sub for 8 months. Dragon's Bane, you're covered under Collie Care from the horns to the dragon tail. I got you covered. Ace Rail coming in with the 5 gifted subs to the community. Dude, what the hell? Holy crap. LaFosta Fox, Sage the Deer. Series the Horse. Joyful Wear. Waffle Fox, you guys are all coming under Collie Care thanks to Ace Rail. From the flops to the beans, I got you covered. Can I start the goddamn stream already? For the love of Christ. I took 1 sip of coffee. And we're 10 minutes into the stream. Jeez. Dude, you guys are insane. Thank you. I didn't even get to say hi to everybody. Rick DeFoyo, Rex Collie, Gurgler, Diffuse, Rob Map, Kai Aiden. Kai, shouldn't you be at work? Don't you work right now? You better be keeping an eye on those patients. It's Haz, Catnip, Sage the Deer, Shugaka, Biko, Bendy. What's up, guys? Welcome in. Holy crap. Jeez. Ace Rail.
Coffee.
Ace Rail coming with 1,000 bits, dude. Look at that werewolf go. Thanks for making Tux dance. The USDA Prime werewolf right there. Ace Rail, thanks for the 100 bits, dude. Seriously, you just got here. What the hell? God damn it.
Yay, stream baby.
Oh
He'll
my
let
God.
you deliver it, Cinder.
Another freaking baby, guys. I don't know what the hell. Who the hell's the father? Which one of you's taking responsibility for all these damn kids? It ain't gonna be me. Beta Pup coming in with the tier 1 sub for 9 freaking months. Dude, Beta Pup. What the hell, man? You've been here for so long. Beta Pup, I got you covered under Collie Care. From the alpha to the cat. Because you're a Beta Pup, I got you covered. That's what I'm going with. Oh, hello. Unbelievable, Doug. Unbelievable.
To help with the child support.
Holy crap, Jacob coming with 100 bits. Thanks for making Tux dance. USDA Prime Werewolf. Ace Rail coming with the 500. Disappointing Doug. Unbelievable, Doug. 500,000 milligrams of morphine. You trying to kill somebody? Unbelievable. Thanks for the 500 bits, dude. What the hell? Guys, damn it. I haven't even gotten a chance to complain about work yet. I got a lot to complain about from this weekend. Rick coming
Hey,
with the 2
Cinder,
bits.
so who's the baby?
Who's the baby? I don't know. We got triplets today. I don't know who the father's gonna be. It's either gonna be Diffuse, Rex Collie, or Banapop. Who's taking responsibility? Who wants these kids? 'Cause I sure as hell don't want them. I got enough on my plate. Thanks for the 2 bits. I'll make sure to grab a haircut with it. Oh, finally. Coffee. Guys, this weekend was crazy at work.
Everybody do the
Oh my god!
Everybody do the flop. Everybody do the flop.
Dude, Ace Rail! What are you doing? Come with another 5 gifted subs to the community. Holy crap, dude. Cheesy Boy, Spiral Blaze Gamer, Fuzzbutt.
Congratulations
Camera,
on the new
and
babies.
Z-Beast coming in with, God, I'm all flustered. I'm all flustered. Hold on a second. You guys are all covered under collar here. For the flops of the beans, I got you covered thanks to Ace Rail. Dude, thank you. Rick coming in with another 2 bits. Congratulations on the new babies. I don't want them. I'm gonna go safe haven these babies. Where's the nearest hospital? You have 3 names to pick out. You guys are picking out the names. They're your babies. Cheesy Butt, thanks for the follow. Welcome to Floppy Flock. Welcome in. Guys, seriously, holy crap. Can I drink my coffee for the love of Christ? I'm so thirsty. I'm so thirsty. I crave my caffeine. I need it. Please. Please. Just let me drink. Have I had my rabies shot yet? Excuse you. That's personal information. Personal medical information that you don't need to know. Also, guys, real quick, I updated Better Twitch TV. Those are all the Better Twitch TV emotes. If I can't have partner yet, then at the very least I can make all of my emotes available to you guys while you're in the stream. Then you can see some of the emotes that I don't currently use, such as what do I got? The coffee mug, the wave, the pog, the laugh, and then the poggers, and then all the animated ones too. You are the bean. I want beans. Can I get them beans? I feel bad for my microphone. I always bump stuff into it. Dresco, the Angel Dragon, thanks for the follow. Welcome to the Floppy Flock. Koga Silverfang, thanks for the follow. Welcome to the Floppy Flock, guys. So seriously, okay, so this weekend. Dude, this weekend was crap. Work, dude, our hospital's so busy. We're like 95% full at the moment. So like nothing is moving. Like the ER, like nothing is moving through the ER. Everything is taking forever, like hours. I saw some pretty cool stuff though. I got a lot to talk about. If anybody redeems the story, I got a lot to pick. Wash your paws and wear a mask. Yes, please, wear. Okay, I'm gonna say this once. You can clip it. You can cut it out. But I'm only gonna say this once because it's important. Wear your fucking mask. Just wear the fucking mask for fuck's sake. It's not that hard. Okay, I feel better now. Rex Collie coming in with the interesting nursing story. Okay. Which one? Okay, I'm gonna give you guys some options because then you'll have an idea of what's to come later. I have a 20. So Rex, you get to pick. You get to pick which one we're gonna do. Series, thanks for the follow. Welcome to the Floppy Flock. Welcome in. Or Sarais, Sarais. Guys, I'm trying to tell a story. Dude, Biko the Wolf coming out to tier 1 sub, gifted out to Flyzik. Flyzik is coming in the. Oh god, hold on. I was trying to talk. Flyzik, you're coming under collar care from the Foo Dog curls to the tail. I got you covered. Biko, thank you for the gift of 1 sub to Flyzik. Guys, Flyzik is the one who converted this model into VRM, so I can do things like this. And things like this. And also things like this. That was all Flyzik's doing. He took it out, he took the VRM model and did all this. He's good. He's good at what he does. God damn it! Okay, we done? Oh, I'm gonna get to that if you give me a second. Buddy coming in with the tier 1 sub for 2 freaking months. Dude, buddy, you're covered under collar care from the bunny ears to the cottontail. I got you covered. Enjoy your uncommon sheep. Biko the Wolf gifting another tier 1 sub to Trevor. Trevor the Wolf, you're covered under collar care from the metal horns to the tail. I got you covered. Biko. Biko. Thank you. Thank you, Biko. Okay, hold on. No stories for Kali, only announcements. I'm freaking trying. Okay. Rex Kali, you get to pick. Here are your options. You get to pick. Dude, guys, thanks for the hype train. Holy crap. You get to pick. You ready? So we have the 22-year-old who was hungover, my old lady who fell and hit her head, or, oh, hold on, my 60-mile-an-hour car accident, or the guy who decided to fight a table saw. Which one would you like? Am I a doctor in real life? No, I'm an ER nurse. Table saw. But Gerg, it's not your decision. It's up to Rex Collie what he wants. Let's hear about the table saw. Okay, I figured. I actually have a picture that I'm not going to share, but I have pictures of it. It was pretty neat. This guy was working on something with a table saw, and I don't know. I think he slipped or the wood slipped or something. So his right hand. You take your palm, put your palm facing away from you. Okay, palm facing away. Okay, he got down to the bone on the pinky. So he actually had an open fracture of the pinky because he got about halfway through the bone. For the pinky was about halfway through, and then the the ring finger was about a quarter of the way through. But his pinky, oh man, his pinky was all just nasty. He had to go to surgery to get it fixed because he basically, he almost for all intents and purposes, he cut off his pinky. He was super chill about it too. The entire time, the guy's just sitting there, calm as could be. I was like, does it hurt? He's like, it burns a little. I'm like, dude, your hand is literally like, you almost cut off a finger, and the best you can give me is, it burns a little? Remember when I've talked about in the past that pain is subjective, right? And that when you're in severe trauma, your body does a very good job of protecting yourself. Which is why I always tell patients to be honest with me about your pain, because I'm gonna be honest with you, the people I've seen who should be in the worst pain are usually like the calmest ones. They're just chill. Adrenaline's a hell of a drug. Absolutely. There you go, Rex Collie. I have a picture of it. I actually have 2 pictures of it. I'm just gonna look at them. I want to see I like looking at pictures. If at any point you guys interact with me in person and you ever want to see the pictures of these stories that I've told, let me know, because I have pictures. I'm not gonna share them on Twitch, and I'm not gonna post them online, but I do have them. If you ever want to see gross pictures of things I deal with at work, ask me in person. That's the only time I'll show you is in person. Exo, Emily. Exo, what's up, Exo? I know you're not Emily. I did that on purpose. Dude, Playful Ocelot coming up with the tier 1 sub for 1 freaking month. Guys, we have a new subscriber to Collie Care. Playful Ocelot, you're covered under Collie Care from the flops and the beans. I got you covered. Enjoy your new emotes. Enjoy them. Jokin, what's up? Jokin, welcome. Thanks for the follow. Welcome to Floppy Flock. Welcome in, guys. Jokin is the one who actually worked on this model. Jokin is the one who made this model, or rather, converted it over and reskinned it and all that stuff. It's awesome. Axo the meal. I don't know. Axo, I feel like you wouldn't like. Would Axo be a good meal? Kind of like sticky, like slimy, maybe. I don't know. Oh, I don't know. An acquired taste, sure. We'll go with acquired taste. I think I'm gonna pass. Guys, okay, so today Today. Also, I have more stories. If you guys want to hear more stories, let me know. But you gotta redeem them. You gotta pay for it. I'm not some cheap story whore. You gotta pay. Today, for class, we're gonna talk about everybody's favorite topic, needles. More importantly, more specifically, venous access devices. How we get access to your veins and what we do with it and why we do it. So, I'm letting you know right now, you're gonna see some needles. None of them are gonna be like, there's no pictures of people getting poked, but you will see needles. So just so you know, be ready. Sharing pictures won't cause problems with HIPAA, will it? Feels like patient's personal information. So, as long as there's no identifying information, and we also, whenever we get the picture, it's always with the consent of the patient. Because doctors send pictures all the time to each other. They're just medical pictures just floating around. The important thing is that there's nothing in there that is patient specific, right? There's no identifying details, no information, nothing. And like I said, I never take a picture without the patient's consent. And I tell the patient, I say, I like to take pictures because I like to show it to my medical friends. And if they say no, then I don't do it. If they say yes, then I'm like, cool, thank you for letting me take this opportunity to do it. I like sharing things. You guys need to see, if more people saw what we saw, you would take better care of your body, trust me. Hold on, I want more coffee. This cup wasn't enough. Hold on a second, guys, I'll be right back. I'm gonna grab some coffee, I'll be right back, hold on. I'll be right back. I'm walking away. Oh wait, I forgot my coffee mug. Oh God! Rona! Rona, please! Don't take me, Rona! Burn the chat down, you better not be! Oh, I gotta kind of reset myself here. Ugh. Get my microphone. And we gotta hit this button right here. Boom! Done! Reset with coffee. No more collie stare. How's that for a collie stare? Burn the chat? No! Stop it! Don't burn the chat! I work so hard! I work so hard to make this chat! You're trying to burn it down! Don't burn it down! Don't, please! Please! Will collie care turn my ears floppy? Maybe? I'm not allowed to speak on matters that are under legal investigation. Here's Western Black Wolf. Thanks for the follow. Welcome to Floppy Flock. Welcome in. You gonna make that redeemable? Maybe. Not a bad idea. Who's texting me? Ah! Joking, that looks good. Guys. Are you ready for classroom? You guys want to learn? You guys want to learn about needles? You want to learn about IVs and venipunctures?
Woohoo! Shot spot!
Hear ya? Puffy! I see you, Puffy. Hold on, it's coming. I see it. Give it a second. Ah. There it is. Puffy,
Cinder
come in.
7 flop, Cinder 7 flop, Cinder 7 flop.
That one took a little bit. Puffy, come in with the 2 1 2 3 2 1 back. That's goddamn it.
Puff.
Hold on, Magnus. I'll get to you in a second. You can wait. Puffy, come in with the 2 1 for 2 freaking months. Dude, Puffy, enjoy your uncommon sheep color. Puffy, I got you covered under collar care from the UF to the E. You're covered. Magnus, come in with the tier 1 sub for 4 freaking months. Dude, Magnus, you're covered under Colicare from the dragon horns to the stompies. I got you covered, Magnus. Always a pleasure to have you around, Magnus. Cinder's like, want to learn about needles notifications? Woohoo! Shazbot. Shazbot. Holy Carrot God, thanks for the follow. Welcome to Floppy Flock. Welcome in. You're a carrot god? Does that mean you're like god of carrots, or that you're a god who is a carrot, or you're a god who serves carrots? I'm confused. What kind of a god are you? All right. You guys ready to learn about needles? Pointy things. Sharp objects. Stabbings. So that's what we're gonna do. We're gonna stab people. You forgot to pay for Colicare this month. That's okay. Wait, hold on, wrong email. That's okay. You'll get your coverage when you need it. God of the Carrot Land. Is there carrot? I didn't know. I guess there is carrot land, I guess. Land where carrots are grown. Technically. God, okay. I thought you didn't have money. Tori Darkfire coming in with the Twitch Prime sub. Dude, you're coming under Colicare from the flames to the fire. I don't even know. From the flops to the fire. I got you covered. Toki, thank you. Also, I didn't have the money. Okay, guys, seriously?
I hope this isn't too disruptive while you're stabbing.
Yeah, I'm gonna cut you down, numinous trees. Oh, I don't know. That was a weird. Oh god, the voice crack. Oh god, it's just a disaster. Numinous trees coming in with the Twitch Prime from. Start over. Numinous trees coming with the Twitch Prime sub for 7 freaking months. Numinous trees, you're coming under Colicare from the leaves to the cellulose. I got you covered. Cause you're a tree. You guys have cellulose, right? What is it? I don't even know. I don't even know. Can we teach? Can I finally teach? Huh? Please? Please? Okay. Good. You're a dragon. Well, then I got you covered from the dragon flame to the stompy hooves. How's that? Good? Okay. It's a ploy to avoid the needles? Too bad. Kai, as you know what, guys! Joking, coming in with a tier 1 sub for 1 freaking month. Dude, joking, you guys, we got a new subscriber to Colicare. Joking, you're covered under Colicare from the flops to the jackal. I don't even, what do jackals have? They have, do they have pointy ears? I don't even know. Joking, you're covered under Colicare from flops to the beans. I got you covered. Joking, thank you. Enjoy, you guys spam the flops. Just spam them. Wait, that didn't go through. What the hell? Spam the flops. There we go. From the 18 gauge to the 24 gauge, I'm gonna stab your veins. Okay. Okay. Guys. You know what time it is? Time to sit down. Time to shut up. It's time to put your asses in those chairs, because it's time for class. You ready? Okay. Yeah, take it down, people. Take it down. Take that down. Hey, Brendan, thanks for the follow. Welcome to Bobby Flock. Welcome in. All right. We're going to talk today. We are going to talk about venous access devices, or different types of venous access. So, basically, anything that we stick in you to get blood work, or to cannulate a vein, or give medications, we're going to be talking about today.
Woohoo!
So,
Shazbot!
hold on. Where's my notes? My notes are right. What the hell? Where'd my notes go? And move that over there. Okay. Venous access. Accessing a vein. How many people, I imagine all of you, have gotten blood drawn? If you've gotten your blood drawn, put 1 in the chat. If you've ever gotten your blood drawn before, put 1 in the chat. I imagine this could be like all of you. It better be all of you. I really hope it is. Let me see. I was gonna look for something. There's one more picture I forgot to grab. A lot of ones. That's what I thought. Okay, let's try this. Put a 3 in the chat if you've ever gotten an IV. Who's ever gotten an IV before? Ooh, a lot of you. Okay, let's try this one. Put a 5 in the chat if you've ever gotten a central line. I would be very surprised if a lot of you guys if there's anybody in here. Who's ever gotten a central line before? Who even knows what a central line is? A few of you, really? All right, even one more, and we'll talk about some of the others too. But who has ever put a, let's say 7? Let's go to 7. Put a 7 in the chat if you've ever had an arterial line. Has anybody ever had an arterial line before? Now, I would be very shocked unless you have some kind of underlying health conditions that require you to get this. Ooh, excuse me. Is PICC line an arterial line? It is not. PICC line is a central line, peripherally inserted central catheter. We're going to talk about that. Ah, sweet. Okay, so nobody knows what an arterial line is. Except for Kai Aiden. Kai knows what an arterial line is. They're like, ICU's like the master of arterial lines. You guys love your art lines. Okay, so let's start with the most basic thing. Anytime that you go to access a patient's vein, or you go to start an IV, draw blood work, anything, the first thing you got to do, you got to clean the site. So, you get something that looks like this. It's our little IV start kit, little venous access start kit. So within this kit, you're going to have a couple things, and they vary from manufacturer to manufacturer, but for the most part, they're going to have the same few things, okay? You have chlorhexidine, which is a cleaning solution, so you always want to clean the site before you stick anything through it, right? The skin is very dirty. You don't want to be dragging any of that bacteria into the veins with you. So you always got to make sure that you clean the site very thoroughly with chlorhexidine, which is a antiseptic that we use for patients on, they use them for like before surgery and whatnot. It's very, very good. Think of it like alcohol and iodine, but better. Okay? You're going to have your tourniquet, which the tourniquet is what we use so when you access a vein.
Woohoo!
So remember
Shot
this.
spot.
Oh, Chase Equipment, thanks for the host. So remember, the veins are going back towards the heart, right? So they're going back towards the heart. So they're usually going to be going up like this, right? Like this is your arm here. Yeah, this is your hand down here. They're usually going up, which means there's not a lot of pressure on them, right? So what the tourniquet does is when you wrap a tourniquet around someone's arm, right? What that does is it creates a bit of pressure, and this starts to kind of back up down here in the veins, and it makes them plump up. It makes it a lot easier to see them. It makes them a lot easier for them to be palpated or touched. You can feel them, right? And not only that, it gives us back pressure to draw from so we can get our blood work. Because sometimes if you don't have a tourniquet on a patient, you can still get an IV, but when the IV goes in, think of it as it's like merging with a highway almost, right? We need blood flow to flow back up and out. So if there's not pressure over here, there's nothing here to cause pressure, it's hard to back draw it back out, okay? That's what the tourniquet's used for. You have a tegaderm, which is this clear dressing right in here. A tegaderm is just a clear, transparent, sticky dressing that we put over the site to be able to monitor it. And then you get some tape and some gauze. This is what comes in your start kit. So, you get your start kit, you walk into the patient's room, let them know you're going to stick them with a needle. And you got to try to find your site. So, for blood draws and for IVs, the most common places are going to be in the arm, right? They taught us in nursing school to work from the furthest end up, so distally, and you work more proximal. So you start in the hand, then the wrist, then the forearm, then the elbow, and then further up if need be, right? That's what they teach you. Let me tell you, in the emergency department, there's about a 90% chance you're getting one in your elbow. It's just going to happen, what we call the anacubital. Oh, excuse me. Hold on, let me fix the lighting on VCFit. There we go. Get it off my face a little bit. So, your typical sites. Let me see. Actually, I should have grabbed one of these pictures too. Perfect. But here are some of the sites that we like to use on the arm, right? So, some people come down. I'm gonna be honest with you. I don't like sticking people in the hand, and I'm gonna tell you why. I think it hurts. These veins are usually pretty fragile, and they're also pretty small. And I don't mess around with small needles because we're in the emergency department. So I don't really mess with the hand too much, but you can get them in the hand. Sometimes around here in the forearm, you can get a few of these. Some people, this guy right here that kind of comes up over the wrist, that one pumps up really nice with a tourniquet sometimes, and it can be really easy to get that one. But primarily where I'm sticking patients is right in here. Somewhere in the basilic, kind of like at the tail end of the basilic. So they usually split right in here, right? So I'm usually going within this area, which is right around the elbow, what we call the antecubital. If you've ever had an IV in the elbow, you know how much of a pain in the butt it is. But those are also like the juiciest veins. Where did I go to med school? I didn't go to med school. I went to nursing school. I'm not a doctor, damn it. Eats my cheesy. Dude, Shadow Fluffy Boy, you eating in the back of class? Disgusting. Oh, it's cheesy. Jesus, dude, Shadow Fluffy Boy, you know what's gonna happen to you. You're gonna be sitting back there. You know, you're munching away on your cheesy, greasy chips. Meanwhile, I'm up here lecturing. You know what's gonna happen? The room's gonna fall silent. Somehow everybody's gonna know it's you. Because all of a sudden, in the back of the classroom, Shadow Fluffy Boy is gonna be all like... And he's just gonna rip ass in the back of class. And everyone's gonna know it's you. And you know why? Because it's gonna smell like crap. We're all gonna be nauseous from the fumes. And that's what you get for eating in my damn classroom. Where'd I go to nursing school? I went to Northern Illinois University. Huskies! Go Huskies! Okay, so you got your juicy veins here in the arm, okay? So we're going to start with the least invasive procedure and work our way up to the most invasive or the most complex procedure. So when we start referencing some of these like IVs and blood draws and whatnot, just remember probably about 95% of the time it's going to happen in one of these veins in the arm. Okay? Okay. So blood draw. So blood draws or phlebotomy or venipunctures, whatever you want to call them. You guys have all had this done before. Nurse's hobby, feeling up friends' arms for juicy veins. Kai, I do it all the damn time. All the time. Tux gets mad at me because I always like to palpate one of his AC veins, and he gets super mad at me. He's like, stop poking me. He's like, stop it. Stop pretending like you're going to put an IV in me. And I'm like, I'm sorry, I can't help it. It's just so juicy. I just want to stick a needle in you. And that's how you know you're in love. So, blood draws. Blood draws are straightforward and easy, right? You stick the needle in the vein, you draw blood from it, right? Remember, we use the same kit. So you're going to clean the site, you're going to put your tourniquet, on, you're going to clean the site, and then you're going to draw the blood, okay? Who here has ever been stuck by a butterfly needle before? Pretty obvious why they call them a butterfly needle. Get these little guys right here to kind of stabilize everything. Looks like a butterfly. So this is what a butterfly needle looks like. Now, I get this all the time with patients in the emergency department. And so I'm going to set the record straight right here, okay? We cannot use butterfly needles to start IVs. I have patients all the time. Oh, you're going to have to stick me with the butterfly needle. You're just going to have to use it. It's the only thing that works on me. And I'm always like, no, we don't have them. Butterfly needles, because they are only used to draw blood, they are a very small needle. They're very small gauge. I'm talking like 24, 23, 25 gauge needles. These are very small. The higher the number, by the way, the smaller the gauge. These are very, very tiny needles because all you need to do is access the vein. You don't need to insert anything into the vein. So all you got to do is access the vein. This one's not that great because it doesn't actually have a chamber. There's usually a little chamber right here that like a flash chamber that fills up with blood when you hit when you get in the vein, so that you know it's that it's there. But butterfly needles are very small. All right, they look like this. You put a little vacuum chamber on the end of this thing, and then you get your blood work from it. This is like the most basic blood drawing stuff that we use. Some places use straight needles, but same idea. It's just a small needle. Okay, nothing over it, just a straight needle with a hole in it. No catheters on it or anything like that. You guys have all had this done. You should have, at least. If you've ever been to your doctor before, you've all had this done. You know how much it sucks, but also don't be a big old baby. Is there a 1 gauge needle? No, the biggest I've seen is a 10 gauge. I have a picture of it. I'll show you that here in a little bit. Let me see. Can I do this? This. Ah! That's not what I wanted. No! Wait! What? Okay, you know what? We can do this. Move that over there. And put that over there. Okay, perfect. Okay, cool. So I need all this room for IVs! Hold on, I always forget if catheter is E. Is it ATER? No, it's ETER. Okay. An intravenous catheter, also known as IV. If you ever heard us call an IV, it stands for intravenous. One of your sheep jumped over the fence. Jason Quiver, go get it! You were responsible for watching them. Why isn't it called a mosquito needle? I mean, could you imagine if I walked into your room and said, I'm going to draw your blood with this mosquito needle? You wouldn't. Butterfly sounds nicer. No one would let us draw their blood if we called it a mosquito needle. That's kind of hot, Axel. What the hell? Why? So IV, so intravenous catheters. So when we put an IV in, I'm gonna try to draw this as best I can so you guys understand this. So you have your skin here, right? Then say you have your vein. You're just kind of hanging out right down here. So there's your vein, right? It's full of juicy venous blood. Get all that deliciousness in there, right? Nice and plump. So when we go to put an IV in somebody, the needle itself, so what the IV looks like, so you have your needle, which is a gauge of needle, right? It's the same gauge, like it's just like blood draw needles. They have different gauges. But over the needle, so the needle sits within a catheter. So there is a thin plastic tube that sits over the needle. And what we do is when we stick the needle in, we go through the skin and into the vein. And then once we get into the vein, I'll use like green, the catheter that's sitting like right along the needle here, we slide the catheter into the vein, and it kind of sticks out with like a little hub up here, right? And then the needle comes out. The needle comes out. So if you ever get an IV in, you do not have any needles left in you. All that's left in you is a flimsy plastic straw, what we call a catheter. Okay, so the needle is used to access the vein, and then we slide the catheter in over the needle, and then we retract the needle out. Okay, so remember, no needle is left in you. Kind of kinky. What, getting stuck with needles? Dirty. Y'all getting kind of lewd. You better behave in class, so help me God, I will send you all to detention so damn quick. Your parents are gonna be so mad. You're gonna be grounded. You won't get to play your new PS5. Or your Xbox Series 1, or your PC 2. Yeah. You're gonna be grounded. You better pay attention. You better shape up. You're gonna bow out. I thought I could handle the conversation, but I'm getting a little... Lady Octopus, take care. I'm sorry. I hope you feel better. Go rest up. Go rest up. So, when you get left, there's all that's left inside of you is a catheter. Okay, there's nothing sharp, nothing's gonna poke you, okay? No needle in your arm, nothing like that. So, IV catheters. Look something like this. It's gonna be a big picture, I know it. I knew it was gonna be huge. It's so big. There we go. That'll work. So this is what an IV catheter looks like. Although this image got compressed to all hell. So these ones, actually, these are different ones. So these are spring-loaded. So when you hit the button, you hit this little button here, and then the actual needle retracts. It's like spring-loaded. It retracts into the container here. But this is what an IV needle looks like, okay? So you have your varying sizes here. This is a 24 gauge. Okay. You got a 22. This is a 20, 18, 16, and 14. Okay. They get progressively larger as you go. And then you can even go up to 12. And I've seen a 10 before as well. Okay. So what happens with this? So when you stick this in a patient, let me real quick before we move on. You see this part right here? This is what we call the bevel. The bevel of the needle is what we call that. When you go to stick an IV into a patient, the bevel is always facing up. The catheter starts right about there. So once you get this part into the vein, you can then advance the catheter in. Okay? But the bevel of the needle always goes up. Okay? So what happens? You stick a patient with this, right? You hit the vein. There's a little chamber in here that fills up with blood. You see that's what we call a flash chamber. So when we say we see flash, or we got a flash, it means that we got blood in our chamber. There's a little vacuum sealed chamber. Guys, stop being so lewd in class, so help me God, I'll get you all in trouble. Be mature about this. This is important. These are needles. They're sharp. They're not for fun. They're not gay. They're not toys. Although I definitely we're pretty damn good with them, so they might as well be tools. They're tools, not toys. Stop being so damn horny. Deviants. Seriously though. Focus. Needles. So, you hit the vein, you get a flash in the chamber, you advance the catheter in, and then you retract the needle out. These are the ones that I use. I like the 18 gauge needle. 18 gauge needles are perfect. They are big, they are sturdy. They're not too big that you're gonna scare people, but they're nice and sturdy and you can give a lot of things through it very quickly. This is what we use on our little babies, little infants. This is what I use on toddlers and like school-age children, like under teenage years. I will also use a 22 gauge on a very, very small, old, frail, like grandpa, grandma, who's got like nothing. 20 gauge is your standard adult-sized IV. 18 is for your traumas and your emergencies. 16 gauge is for your traumas. 14 gauge is for your traumas. I have never stuck a 14 gauge needle in someone. I've done 16 gauge a couple times. 16 gauges are fun. It's a massive needle. And it works great. It's so good. So here's a quick picture of what it's going to look like when you get access to someone's veins, or how... God, why are all these pictures so big? Oh my God. Oh, this class is a disaster. Whatever, we'll just do it like that. Perfect. Good enough. So you gain access to the vein. You see the little catheter sitting in here, right? And then you tape off all that. And then there's a little lure lock on the end of this. There's a little lock that we can then use to hook up syringes and push medications in. So that way we don't have to stick you again. We can also draw blood out of this as well. Okay? So, and it's important that I show you this picture because you're going to see as we get to progressively longer and longer catheters, these are really, really tiny in comparison. A midline catheter. Who's ever had a midline before? Who's ever had a midline? King of Boo Woo. Bye. Bye. Take care. Saline makes you go. Brr, brr, brr. What needles do for sleep? Wait. What do you mean? What needles do for sleep for surgery? You talk about what needles do we use? I usually just use IV. Yeah, we just put an IV in. Through an IV, we can give medications, we can draw blood, all that fun stuff. Midline catheter. think of a midline catheter. So this is what we call a peripherally inserted IV, or peripheral intravenous catheter, right? It's peripheral because it's on one of the peripheries. It's on your arms, on your peripheral vascular system, right? And it's a venous catheter because it goes in your veins, okay? Really tiny. A midline catheter, think of it as a longer peripheral catheter. So where this one just kind of stays right here in the vein, it's kind of a short catheter, stays within that small area. A midline catheter is going to go far further up. So here is roughly about where a midline catheter will go. So the midline catheter is inserted in the arm. There's a needle that's stuck into your arm, and then there's like a little guide wire that they use to guide the catheter up to roughly about here, right about your armpit. And then this is secured down here, and now we have a nice stable IV. Midline catheters are used. Okay, King of Owu, Joy, your timeout. Midline catheters are used for patients who have hard trouble getting. If you can't get a vein started, if you can't get an IV on a patient, the next step is to go to a midline catheter, because what they do is they use an ultrasound for this, because they need to get to one of these deep kind of big veins. So they use an ultrasound device, and it's a specialized team who comes in and does this. I do not do midline catheters. I am not trained on how to do midline catheters. I never want to be trained on how to do a midline catheter. Although, maybe I do. That actually might be kind of fun. But they come in with like a an ultrasound machine. They stick you with this big needle, and then be massive. I know this picture is huge. Oh my god. So they have this little device here. So this is your needle here. You can see how big that needle is, right? And then this right here is a guide wire. So what they can do is they can kind of feed a wire into the vein, and then this catheter goes around that, and then they pull the wire out. So this is just a longer version of this. Same thing, maybe a bit more flexible, but it's just a longer version of that. But this is in a more stable vein, so if you have trouble getting patients IV started on a patient, you can get a midline catheter. This is not a central line, though. A lot of patients, and a lot of, hell, even some of my colleagues are confused between the difference between a midline and a central catheter. They are different. Similar techniques and similar ideas, but they end up in different places. So the midline catheter does not enter into what we call the central venous circulation, or like your inferior or superior vena cava. It stays here within one of the accessory veins. I think, what is that? That would be your cephalic vein. And then this is your subclavian underneath here, right? It doesn't come into the central part of the body, though. So stable IV, but not a central line. But I'm super happy to have one of these because they usually work really well. Is this also how they implant angioplasties? You talk about like when they do like heart caths. It's a little bit different because those go in through the arteries. It's a bit of a different technique, but the same idea of accessing the vein and then feeding a guide wire up to where you got to go, and then sliding a catheter over that guide wire while you remove the wire. That technique is utilized over and over again with any kind of venous access or catheters or anything like that. What's Cinder voice? It's when I talk like this, when I talk in character for 5 whole freaking minutes. You guys like when I talk like this? It's my character voice. I don't teach in my character voice because it takes a lot of energy to do it. Be angry. I'll show you freaking angry. All right, central catheters, central lines. Who's ever had a PICC line before? Who's ever had a PICC line, central line? I know you guys already put those in there. But a PICC line or a central line, we call it a PICC line when you get it in the arm. So I'll tell you the difference between them. A central line is a catheter or an IV, essentially a long intravenous catheter that ends up within central circulation. So where it ends is going to be somewhere within the central part of your body. So kind of how I think about it, right? Central line, central. So there's multiple places that central lines can be inserted. The most common one is going to be what we call a PICC line, which stands for peripherally inserted central catheter, PICC. We use the same technique that we did for the midline, essentially, but instead of stopping here around the subclavian, they continue to advance it into what we call the superior vena cava. The vena cava is the massive vein that goes into your heart. You have the superior and the inferior vena cava, okay? When these lines end up in that spot, we call it a central line. So a PICC line is one of the most common ones. We use PICC lines for patients who are going to go home with like, if they're getting antibiotics at home, or if they need access for a long time. PICC lines are usually good for like a couple months. They're good for a long time. Problem with PICC lines is there's a high risk for infection with these. If these are not cared for properly, what can happen is you get a little bit of infection here on this catheter. Well, guess what? It can ride that catheter right to your heart. And then you end up with what we call like an infectious endocarditis or an infection in the heart. Okay? They're very, very dangerous because they have a high risk. They have a high reward because they're stable veins. PICC line is the most common. Internal jugular, we see this from time to time. Some docs like this for certain procedures. Some docs do this during code situations when we need access. Although generally speaking, we're not doing a central line up here when we need access during a code. We're going to go down here to the femoral vein because usually we're doing some kind of airway management up here during code. The femoral central lines, this is what we put in during code situations. If you have a patient who's coding, who's dying, and we cannot get access, or even if we do have access, sometimes the doc will try to put in a central line in the femoral vein to give us very, very stable venous access. This one happens a lot during codes. This is one that we send patients home with. You can also have a subclavian insertion where you go up underneath here, the clavicle. We have a few docs who do this when we have trouble getting an IV started on a patient. They'll just go ahead and put a subclavian central line in. That would be right up underneath your collarbone is where they stick you for that. Central lines are amazing. I love when patients come in with central lines because I know that I'm going to have really, really good vein access the entire time they're with me. And also I can get blood work off of this. Not only can you push medications through this, but you can also draw blood from it. Same with midlines. You can do the same with midlines, although midlines are more likely to not give you blood back because there's not a whole lot of pressure up here. And they're more likely they just don't like to give blood sometimes. PICC lines, though, and central lines they're in such a big vein that you can almost always get blood from it. I think I'm starting to get squeamish, Mr. Colley. Can I skip class? Please do. If you guys feel squeamish, feel free to tune in about half an hour, 45 minutes when we stop talking about IVs and access. Does the doctor do that? Or does the nurse do it? Nurses will do midline catheters. Sometimes it'll be like physician assistants or NPs. Sometimes it'll be like an anesthesia nurse or even like an anesthesiologist will do this. Central lines are almost all doctor driven. Nurses don't do central lines. Too invasive of a procedure. You just pull them out. PICC lines, yeah, I've pulled out PICC lines before and I've pulled out midlines before, and yeah, you just kind of keep pulling and it comes out. It doesn't hurt. It feels a little weird for the patient, but it doesn't hurt. Central line dressing changes. So these dressings that cover these lines, so you usually have like a clear dressing over it, like here, and this one usually has one too. Central line dressing changes is a sterile procedure. Very important that when you do a central line dressing change that you maintain sterility, because if any bacteria or infection gets on this catheter, like I said, it's got basically a highway to the heart for infection. You have to be properly trained on how to change the dressing in a safe and sterile manner. It's a pain in the ass is what I'll tell you. Doing a central line dressing change is a pain in the ass. Excuse me. I don't like doing them. Let me see. So now we're going to start getting into some more complex things that we don't see. These are all pretty common. Venipunctures are common. IVs are super, super freaking common. Midline catheters, moderately common. Central lines, we see them often enough. The next ones, though, you see maybe a little bit more common than central lines, but if you've never seen one before, if you've never heard of this before, you're gonna have no idea what this is. Does anybody know what this is right here? Has anybody ever seen one of these before or knows what these are? Has anybody ever seen an implanted port? Portacath? This is actually this is a power port. Because I feel like anybody nowadays, if you're getting a port placed, you should just get a power port. What this is a device that we implant into a patient's chest for patients who need frequent blood work, frequent medications. Typically, what you're going to do with this is your chemo patients, your cancer patients. The reason we put this in there is because not only is the chemo very, very damaging, and it can be damaging to your veins, especially the fragile veins in your arm. It can damage those veins, but also these patients need reliable access to their veins in order to get their medications to save their life, right? So what it is, it's a little port that they surgically implant underneath your chest, and then this tube tunnels up to the subclavian vein and then into the heart. It's a central line. This is considered a central line. What we do as nurses is we access it. We use a specific needle called a Huber needle, which a Huber needle is a needle that's at a 90-degree angle that we puncture through the skin and into this kind of membranous, this kind of like membrane here, which then gives us access to the line. And we can draw and give medications through this. And you can even see it here, how it kind of goes through the skin and into the port. Let me see if I can find a good picture that's medical. There we go, that'll work. No, I don't like that one either. Good. Guy's making a funny face. Oh, that looks like junk. That one's better. So, we access through the skin into the port, and that gives us access into the veins, it gives us access to a central line. I do these often enough. We get a lot of patients, a lot of cancer patients have these. Cancer patients love them. You guys think it might be kind of scary and gross, but I can tell you, if the difference is you get a small stick in the chest after getting this surgically implanted to get access to your veins, and it's super easy for the nurses, versus them having to stick you over and over again because your veins are damaged from the chemo and the radiation, and they can't get an IV started. Patients love these. Cancer patients love their ports because of the fact that it's so easy to access. What you do is when you feel this, you see how there's this little bump underneath here? You can kind of feel the catheter. You can feel the access site underneath it. You can kind of feel it. And it's super easy. You just take your needle, you just stick it in there. You don't have to think about it.
Mr. Cinder, I pooed. I'll be back in a bit.
Bailey is a chicken. Take care. You pooped. Nasty. Ugh, it smells like poop. Thanks for the 1 bit. I appreciate it. I'll be here. You're getting trained on how to access them? I access them. It's easy. Kai, the only important thing about this is that it's sterile. You have to be sterile for this. It's kind of a pain in the butt having to do it with good sterile field, but it's easy. I actually had it once. I had a kid once who was, I had an 8-year-old who had one of these implanted. Poor kid had pediatric cancer. And we had to I felt bad because we had to hold him down to get it accessed because he did not he hated getting this thing accessed. And understandably, he's 8 years old. But we were we had to hold this kid down, and he was squirming, and I couldn't really get a good grip on the port because it was kind of moving around a little bit because he hadn't finished growing and it wasn't really secure enough. So I just kind of winged it, and I was like, you know what? This kid's squirming around. I don't have a good grip on it. I'm just gonna go for it. And I stuck it, and I hit it, and I acted super cool and calm. I was like, the patient or the family members were like, oh my God, nobody ever gets it on the first stick. And I was just kind of yeah, you know, I'm pretty good at this, right? I walked out of the room with my colleague, and I was like, that was pure freaking luck. I just blind stuck that thing and it landed. I had no chance. I didn't even think it was gonna hit. It was all luck. All luck. But you always play it off like you did it on purpose. Anyways, that's port access. These things are pretty neat. If I have the option available, if a patient has one, I will access it when need be. I much prefer to put a peripheral IV in somebody if I can. And what you'll find is patients who have implanted ports, because they cancer and the chemo and everybody only ever use the implanted port. that what you find is their peripheral veins are actually pretty damn good. So I tell patients all the time, I'm like, look, I can access your port, but for every 10 IVs that I do, or every 20 peripheral IVs that I do, I access a port. So I do this way more often than I do this. So I tell them, I said, I can do it. I've been trained on how to do it, and I've done it successfully plenty of times before, but there's a higher risk for infection with this, and I do this more frequently. So I usually let them decide, and they usually want the peripheral IV. Yeezy! Yeezy Weezy! The coffee yeet himself! Just you guys wait. If you guys thought this was cool, ooh, wait. Just wait a second. Who has ever seen or known of or anything, who knows anything about arterial lines? Who's ever had a family member who's had an arterial line or an art line placed before? Who knows anything about them? What do you guys even think they do? It's in the name. But what do you think the purpose of an arterial line is? Why would we ever need to stick someone in the artery? Why? We do it. We do it all the time. Luck is a fickle mistress. It really is. Sometimes, look, sometimes it's better just to be lucky than to be good. The amount of times I've had patients where I don't actually feel a vein, and I just stick in the general direction of where I think
Mr.
a vein
Cinder,
is.
can you call a hazmat team? I did something to the bathroom on
Bailey is a
accident.
chicken. Disgusting. Nasty. I think I heard you in there. I heard a little bit of a, you know. Yeah, I heard that. Nasty. I've had patients before. I've definitely had it before where, like, I'm like, yeah, you know, there should, in my head, I never say it to the patient. You never tell the patient. Never tell them this. Sometimes you get lucky and you're like, yeah, you know, in my head I'm thinking, yeah, there should be a vein in this general area, right? And you stick it, not knowing what you're gonna get, and sometimes you get lucky. Sometimes you get really lucky and you hit a vein that you had no idea was there. And then you play it off like, yeah, I knew it was there all along. Side question about injections. Are those needleless injection devices I've read actually a thing? Absolutely. Here, let me show you.
Oh yeah, the toilet went boom.
Bailey, another bit. Dude, stop destroying my toilet. Stop it. Thanks for making Tux dance. I appreciate it. Let me see. We call them lure locks. So real quick, before we start talking about arterial lines. So this is what IV tubing and stuff looks like. You have this little, what we call a lure lock right here, which has, this is like your female end, right? And then most of your syringes and IV tubing will have a male end that screws into this. You don't have to stick anybody again. Everything can get pushed through that without having to access it with a needle, needleless. These things are great. David, no! I'm teaching! Hell no! I am teaching! Bailey's a chicken.
Why is my chair on fire?
Maybe because you had ass blasting out your ass. Or, oh, God, I screwed that up. Maybe because you had fire blasting out your ass. Yeah, I heard you. Go clean yourself up. Nasty. So, arterial lines. So, arterial line is a catheter that we can place into your artery. Primarily, we do this into the radial artery, so your wrist. So, this is going to go in your wrist. And what we can do with an arterial line, there's the two main things we do with this. The first thing is you can get blood work off of it, which is fantastic, because you can get arterial blood off of it. But also what you can do is you can hook it up to a pressure bag and a transducer. And what we can do with this is the arterial line's here, right? And then you have a pressure bag and what we call a transducer. The transducer reads the pressure within the artery. So what you get is a waveform that looks like this on your monitor. And this will give us our blood pressure. With an arterial line, we can get real-time blood pressure. Real-time blood pressure. And you can see it correlates with the heartbeat, right? So here's your ventricular contraction. There's your spike in blood pressure. And then it slowly comes back down as you go through diastole and then back up. You get this waveform. And what we can do is we can hook this up to a monitor and we can look at arterial pressure. So certain procedures, certain recoveries, ICU, it's very important to know a patient's blood pressure down to like the exact, right? These patients need their blood pressure managed and monitored that closely that we can get an arterial line and get real-time blood pressure. Actually, Harvey, thanks for the follow. Welcome to Floppy Flock. Welcome in. Alias Chicken, what are you doing? Another bit.
Would you like some of my leftover Taco Bell, Mr. Cinder?
No.
I don't feel well enough to finish it. I gave some to the principal too as a way of saying sorry for the toilet.
I don't want that. Although, they do have that new, like, cheesy gordita grilled, like the gordita with the cheese that's, like, grilled on the side. I think it's good. You guys had that? What do they call it? Like the cheesy chalupa or something? It's like the cheese is, like, grilled on the side of it. It's, like, melted on the side of the chalupa. Oh, it's so good. Alex and I love those things. So arterial line. So back on my, when I used to work on the inpatient side of the hospital, we used to use arterial lines for our patients after they got their carotid arteries cleaned out. So one of our vascular surgeons would go in and he would essentially clean out the carotid artery, which is the artery leading up to your brain. Because some people get plaque buildup in there. You get what's called carotid stenosis. And we can do a carotid endorectomy or endarterectomy where they go in and clean that out. Well, what's important is that these patients maintain a very stable pressure range after that procedure because the access to the carotid artery, if the pressure gets too high, that access can break. If that pressure gets too low, it can represent that they have a leakage in there. So we had to use art lines on the floor to manage that pressure very closely. Ty, you're very familiar with art lines. I know you are because you're an ICU nurse. I know ICU loves their art lines. But you get this waveform and it gives us live real-time blood pressure that we can manage on the spot. I wish we had free healthcare. The bills are way too expensive. You and me alike. I work in the only socialized part of the American healthcare system. Emergency medicine, the emergency department, is the only socialized aspect of American healthcare. We have a law known as EMTALA, which, what is it? Emergency Medicine Treatment, Emergency Medicine Treatment and Labor Act. EMTALA. What EMTALA is a law that prevents us from turning away patients who cannot pay.
I'm all cleaned up. What did I miss?
You missed a lot. Talked about IVs. EMTALA is a law that prevents us from turning away a patient for treatment, regardless if they have an ability to pay for it or not. So we are bound by law to treat patients. We are bound by law to take care of them, regardless if they have any intention of paying us or not. So it is emergency medicine is socialized medicine. Even more so to that point, if we need to transfer a patient to another facility, there are certain criteria that have to be met for us to be able to transfer a patient under EMTALA. We cannot just transfer a patient because we want to. We can transfer patients to other facilities if certain criteria are met. So every time I have to transfer a patient out of the emergency department to another emergency department, so when I have to do like a hospital transfer, I have to fill out an EMTALA form. And if I don't fill it out properly, the hospital can get in a lot of trouble for it. So yes, I agree with you. I wish we had socialized healthcare. But we already kind of have it, but not in the way that you think. Because you'll still get a bill. You will still get a bill from the emergency department. And I'm going to tell you this. I'm going to tell you a little secret. Let me tell you a little secret here. You don't have to pay that bill. The hospital eventually will stop coming after you. We have plenty of patients who come in with bad debt who we still take care of. The hospital will stop will eventually stop hounding you about it, and they will send it to a collection agency. Well, other than being annoying, as far as I know, there's no legal. I don't think there's any legal recourse. I don't think they can, like, you don't have to pay it. Granted, it might kill your credit, but as far as I know, you don't legally have to pay it. I could be wrong. But I definitely know patients who we see all the time who have probably hundreds of thousands of dollars in medical debt who we still treat. You got a question? Go ahead. Kiwa, what you got? Raventail, hey, what's up? Welcome in. Thanks for stopping by. What is an aneurysm, or how can it be taken? An aneurysm is, think of it as a ballooning of the vein or the artery. Typically, it's an artery. So if you have like a normal vein here, or like a normal artery, An aneurysm is when you get like a little deformity like this. This is an aneurysm. This can be caused from excess pressure. So if you have really high blood pressure, you might find an area of the wall that's weakened, and then it balloons out like this. That's an aneurysm. Have you ever seen a car tire that has like a big bulge on it, right? So you got like your car tire here, right? It's got like a big bulge sticking out. That's an aneurysm. Same thing can happen to your arteries. And what's the problem is this wall becomes weakened. This wall of the artery is weaker. So if the blood pressure continues to be high, eventually this is going to rupture. And then you're going to have arterial blood leaking everywhere. I'm from the UK and we really don't want the US system coming over here. Thanks. I work in the system and I don't want it. I don't like it either. I don't. But I don't know what's going to happen. Who knows? I don't know. I'm not going to get into it. I already work in socialized medicine, so as far as I know, make it all socialized so I can enjoy it too. Have I ever done a hospital visit as my character persona? I have not. I have no intention of bringing... as I understand the sentiment, but I have no intention
Can I
of
ask
bringing...
a question about medical transports?
I have no intention of bringing my fursuit into that cesspool of a hospital. Can I ask a question about medical transport? Sure. While you're doing that, we're going to move on to the next line. So, arterial lines. Kai Aiden, you're super familiar with these. They're lines that we place into the arteries to be able to draw blood work, but also be able to monitor arterial blood pressure. Who knows what an AV fistula is? Ooh, I like this song. Maple Man, thanks for the follow. Welcome, Floppy Flock. Welcome in. Anybody know what an AV fistula is? Anybody have any loved ones who are on dialysis, or maybe you yourself are on dialysis? An AV fistula is a surgical procedure that we do, or it's a surgical procedure that we do to create what we call an AV fistula, which is kind of a mixing of arterial and venous blood that we use to access for what we call hemodialysis. So, your kidneys fail you. For whatever reason, your kidneys fail, and you have to go on dialysis. Dialysis, if you don't know what dialysis is essentially external kidneys. Most people go 3 times a week. You go in, they stab you with a needle, they draw
How
your blood,
does life flight
cycle
work?
it through
And what would
filter
happen
and
if
put
a
it back in.
patient is inaccessible to everyone and the helicopter or plane can't fly there, and what if it's too dangerous for anyone to go rescue that person?
How does life flight work? I don't work, so I don't know how they do their rescues. I don't know, and I don't know what happens if they are inaccessible. I guess they just do what they can. They make their best and try to get to them. I know when we send patients via helicopter, it moves very quickly, and yeah, we do it for our really, really sick patients that need to be transported. We send them via helicopter, but I am unfamiliar with how they rescue patients out in the wild and wilderness, or how they get to inaccessible patients. I don't work on that side of medicine. I work in the hospital, not pre-hospital. That'd be a really good question to ask, like EMS, paramedics, maybe people who do like flight medic stuff. So if your kidneys fail you, you have to go on dialysis. There are 2 types of dialysis, there's peritoneal and hemodialysis, but we're going to talk about hemodialysis. Hemodialysis is when we hook you up to a machine that draws your blood out, puts it through a filter, and pumps it back in. Obviously, it doesn't draw everything out at once. The classic and typically most common way of doing this is we create what's called an AV fistula. AV fistula stands for arterial venous, right? AV. What an AV fistula is a surgeon comes in and they create what we call a connection or a fistula between your artery and your vein. So what happens is arterial blood then crosses over into your vein, and you have a mixture of venous and arterial blood. What this does is it causes the vein to balloon and swell up because there's more pressure now. This gives us a consistent high pressure access point to draw blood and cycle your dialysis through. So what happens now, so you create a fistula, and these things can get, they're almost alien, right? Let me see if I can. Find a picture of one that's not super, super gross. That's actually a really good picture. Okay. So they look something like this. Do you see how like bulging that vein is? That's because it is getting a mixture of arterial and venous blood. Obviously, this is a very easy place to stick a needle, right? So what they do is they put a needle in here, and they put a needle in here, and then they hook you up to a dialysis machine, right? Something like that. And then they cycle the blood through. And that's how you get dialysis. I'm going to tell you right now, they use very big needles for this. And there's no, they don't cannulate it. There's no cannula on the end of these needles. There's no catheter. This needle stays in you the entire time. The entire time that needle stays in you. They tape it down, but the entire time that needle stays in you. You get two of them. One to pump blood out, one to add blood back in.
Woohoo! Shotspot!
But this is what it looks like. So, interesting note about AV fistulas. There's two specific things that you assess for with an AV fistula. We call it a bruit and we call it a thrill. You hear a bruit, you feel a thrill. So, if you were to place your hand right here, you would feel a pulse because you have arterial blood mixing in with venous blood. So you're going to have a bit of a pulse. So it pulsates a bit. If you were to put your stethoscope on it, you would hear a whooshing noise known as a bruit.
Ba 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 blee blee ba.
Thanks for the 1 bit. Thanks for making tuck dance. So when you go to see these, or when you get a patient with one of these, you want to assess them for a bruit and a thrill. You want to feel a bruit. I'm sorry. You want to feel it. What is it? No, hear a bruit, feel a thrill. And it's weird. I remember the first time I ever touched one. It is super, super freaking weird. Ooh, it's like it like pulses. It literally like is just a giant pulsating vein that we access for dialysis. Last thing we're going to talk about. Perm cath. A perm cath is another type of dialysis access device. Okay, I guess that's as long. So a perm cath is something else, is another device that we use for dialysis, hemodialysis and dialysis in particular, but it's what we call a tunneled central line. So when we say tunneled, what that means is the insertion site is around here in the chest, right? And then they feed the catheter up. It tunnels underneath the skin until it hits one of the central veins and then goes right into the right atrium of the heart. There's 2 ports on this, one to draw blood out, one to add blood back in. We use this for dialysis. This is temporary. These are not permanent. This is temporary. I wish it was permanent because then we wouldn't have to use this, but this is temporary. The reason they use this is to give us time to get one of these because these need to heal. This is not something that you can just do and access right away. It needs to heal. So that's perm cath. It's another dialysis access. That's it. That's all I got. That's all I'm talking about today. Any questions? Questions, concerns, comments, grievances, last will and testaments? Anything. The winning lottery numbers, anything you want to tell me. Why is it only temporary? High risk for infection. Look where this catheter ends up. It's just sitting in the heart. It's in the right atrium of the heart. High risk for infection. This is not something you want long term. Learning is fun. Yes, it is. Play this? No, I'm good. I got my own playlist. Thank you, though. Thank you. I got my own, though. Can't get much better than Anjuna beats. I've got to say, you're a cutie patootie. Well, thank you. I appreciate it.
You are cute puppy.
Thank you. 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 Give you lickies. Meh, meh. Lickies. Which is accessed for blood donation, vein or artery? Ooh, I don't know that answer, actually. I would imagine it's a vein.
Everybody do the flop lol.
Everybody do that flap. I would imagine it's a vein, if only because accessing an artery is not something that happens regularly. So, I've accidentally stuck people in arteries before. You always know when you stick an artery. So like when you go to do an IV, right? When you hit a vein, the blood usually fills up in the chamber pretty slowly. When you hit an artery, it like poof, it like fills up, like it like explodes in there, and you're like, oh, you're sitting there and you're like, oh, it's an artery, oh god. But hey, you can get blood work from it.
Cinder go BRRRRRR. Cheap go bar.
Hey, Lisa Chicken, thanks for the bit. Buddy, come in with 100 bits. I see it. Hold on, where is it? There it is. Buddy, come in with 100 bits making tuck stance. US
Plays with Cinder's ears and gently boops his nose.
Take your money back. You don't get to pay to boop. I'm not selling my body like that. Let's go back to the nurse station. Why can't they just put a catheter in each vein for dialysis? That's just not. It just doesn't work that way. You might be real, but I'm realer certified West Coast kitty. What? Are you having a stroke? What? Wild Foxy, hey! What's up? Welcome in! Alright, guys. We'll go back to the Talos Principle. I'll play some more Talos Principle. Real quick, I gotta go take a quick bio break because I've had 2 cups of coffee and half a cup of water. My bladder says it's time to go. So, I will be back in just a few minutes. Quick bio break. Guys, do me a favor. Do me a favor. You know the drill. Watch over the sheep for me. You better not lose it. You better not lose any, so help me God. If you lose any sheep, I'm gonna be really mad. Really mad. I'll be right back.
I made a sheep rap. Sheep go bleep 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 bar 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 bleep 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 boom. I'm back. Hold on, I'm coming. Oh, I feel so much better. You guys better be taking care of my sheep. God damn it. Bailey, come in with another bit, dude. I drink me a 2-liter Mountain Dew.
That's a lot of Mountain Dew that you're drinking. That's a lot of sugar, you know that, right? I hope you know that. Alright, I'm gonna get set up here. Microphone over. Hello, chat. You guys are now in front of my face. And this, let me make sure I'm in the right spot. Let me set it, blah, blah, blah. Oh god, wrong
please.
button!
Cinder
Oh god! Wrong button! Don't do Don't listen to that. That was a mistake. Mistake. Disregard. I tried to make sure all the sheep were fine, but every time I count them, there's you guys stop counting the sheep. You're gonna fall asleep. Bailey, okay, Bailey.
We're going
settle
for
with the bits.
420 liters.
I appreciate it, but settle with the bits, please. Please. There's a lot of notifications. Just chill. Guys, I got a granola bar. Huck's got like a big case of granola bars, so I'm gonna munch on a granola bar real quick. I'm gonna give you guys want some rapper ASMR? Just gonna go ahead and open up this granola bar here. Real slowly. I can't get the damn thing open! What the hell? Come on! Oh my god! Oh, it just went everywhere. Awesome, fantastic. I love it. Guys, I am a licensed professional. I handle dangerous drugs every day that I work, and I can't open up a goddamn granola bar. You got a wine? Wait, who did a wine? Oh my god, Yeezy! Alright, hold on. Let me take a sip of water. I can get my mouth.
So I'm not tempted. I'm going to use my last few bits. I wanna be a good proto, but it's tempting to be a bad proto.
Thank you. Don't make me get the hydrochloric acid. I know how it does for you guys. Alright. Wait, who did that? Yeezy. Yeezy, are you ready? Yeezy. Yeezy, please. I'm going back to my granola bar. Oh. And then we're gonna play Talos Principle when I'm done munching on this. I took way too big of a bite. I'm a necromorph. I'm not a necromorph. I got a marker on my desk. Yeah, because we rescued it, and it whispers sweet nothings to me. It always tells me things like, "Make us whole again," and "Dismember their limbs," and "You can set us free." It puts the needle. What is it? Step 4. Cross your heart and hope to die. Stick a needle in your eye. See, it tells me all those things. What's the minimum amount anyone can survive? Sleep. The minimum amount of sleep that you can use to survive? I actually don't know the answer to that. Ask any med student, they'll know. Yeah, they definitely will. Wonder if you should join the Discord. You absolutely should. Although I'll be honest, it's not the most active, but that's because I don't do much of it. But hey, you can totally join it. Also, guys, I updated Better Twitch TV today. If you have Better Twitch TV, you guys have access to all those emotes. All of them. The poggers. The minimum amount is 8 hours, but let's be honest, none of us get 8. I say 6 to 8 is usually pretty good for most people. Okay. Is that a Doom Shotty as well? It is! So we got, hold on, if you guys haven't been here in a while, or if you're new to the stream, let's talk about what we got on the desk. Let's talk about it. We got the Doom Shotgun from when we beat Doom 2016. We got the Roller Coaster Tycoon 2 Carousel, because that was one of the first games we ever played on stream. We got a Who Farted mug from Stanley Parable, because it was just too funny to pass up. We got Spyro hanging out, because we played Spyro Reignited Trilogy and beat that. We got the marker to keep me company during the long, dark nights. We got Jump King up there, because we beat Jump King. And we got, what's his name? Diogenes, whatever the guy in the pod is from Getting Over It, because we beat Getting Over It. Oh my god, that game was so much fun. Is this an average length? Wait, what? Tangerine, what are you talking about? What? What are you referring to? Tangerine. Tangerine Tango Boost! I expected better from you. You should know what the average length is. Like 4.5 inches. Maybe 5. Alright. Let's play games. Talos Principal. Come blast my ears full of super loud music because you don't know how to manage your volume before a game starts. Talos Principal, we're back! It's not a dildo, it's a freaking marker for the last time! Whoa, the audio's weird. Continue! Right, so we beat levels 1 and 2. And now we're in that, like, church temple. We're gonna go to level 3 now. Alright. We beat 1. We beat 2. E-Pirate, hey, what's up? Oh god. Welcome in. Thanks for joining. Soon I will strip you of that bandana. No! Gurg! So help me God, I don't want to be naked! Please don't make me naked, please! Gurg alert, please don't make me naked, please! I'm so cold! My chest floof gets so cold! Why? I'm just an innocent puppy. No promises, listen! I gave you the puppy eyes, you know what that means, you don't have a choice! Alright, so we finished 1, we finished 2. Beep beep. Beep beep. Beep beep. Beep beep. Beep beep. Embrace the word of mighty Talos. He is who is both man and divine. For we are the children of man. Gonna go ahead and do that there. Okay, the audio. Tristan, holy crap! Dude, holy crap, Tristan, the dinosaur! You dino dingus! God, it just got a lot stinkier in here. It smells like millions of years of unwashed dino stoppies. Dude, Tristan the dinosaur coming in with a rate of 165. Holy crap, guys, if you don't know who Tristan the dinosaur is, let me introduce you to his New York accent is great. Just go watch him for his accent. He's funny as hell. He's super nice, and he just hit that partner button. We need a dinosaur partner. We do. Tristan, thank you for sharing your community with mine, and thank you for blasting my ears full of wonderful Andrew WK. Time to party hard, people. Holy crap, Tristan. Ivan Emblem, thanks for the follow. Welcome to the Floppy Flock. Welcome in. Look at all those stompies. So many stinky stompies. Yours look really limp. You know there's blue pills for that now. Extra.
Shotspot!
I like them flaccid. Thank you. Erect ears are inferior to flaccid ears. You know this. New York has an accent? Yeah, they say things like, I'm walking here. And let me get that fresh bagel. Ah, what else does New York talk about? The Yankees. They also like to go ahead and ban this guy, and they also like to cook their hot dogs in water from the Hudson River. It's disgusting. It's absolutely disgusting. It's just honestly, it's a disgrace to hot dogs. Their pizza is so thin you can see through it. It's hardly pizza at all. You call that a crust? It's more like a taco. All right, hold on. What are we doing here? Do I need to read any of this? I don't want to read any of this stuff. What is this? Striation of Stratageria? Okay. I don't really care about any of this. Beep beep. Oh, he turned off. Okay. Easy Flash, thanks for the follow. Welcome to Bobby Flock. Welcome in. Captain Grumpy, take care. Alright, where do we need to go? So there's a big puzzle that way. Let's do some of these little ones first. You know what? I love pizza. Next time I'll order 4 times the sauce on my pizza. That's a lot of sauce. Or I could tell you, just do this. Fade's Equal, do this. Go to Chicago, get a deep dish pizza. You can have as much sauce as you want because it's basically all sauce. It's delicious and amazing and better than whatever New York puts out. Evil Wolf, thanks for the host. Shazbot. Okay, let's go in here. Locked me up, swallowed the key. Excuse you? About to issue a warning syndrome. Why not let me do my job? Dragon's Bane, I got it. I appreciate it, but you could have given a warning, but there's no point in warning for that. That wasn't the first time he said something like that. It wasn't going to be the last. No point in wasting a warning. When people show you who they are, you believe them at the first time they do it. It's simple. I got keys. You know there's a VR version of this game? I do. I'm actually kind of glad I didn't play it in VR because I feel like I would have been, I don't want to say nauseating, but I feel like it wouldn't, I don't think it would have added to the experience as much, you know? New York pizza over, oh, absolutely not! Chicago pizza, best pizza. Hands down, best pizza. There's not even an argument here. Got it! Easy, easy, easy. Milwaukee style over Chicago style. I don't even, is Milwaukee, what's Milwaukee style pizza? I've never heard of that. Chicago pizza is nice and all, but it shouldn't be called pizza. It's more like a casserole. Get out! Get out! You think I'm joking? Come here. Like, come here. Come here. Hold on. Yeah. Switching. Yeah. Saying stupid things like that. Yeah. The best pizza. Huh, okay. It grabs Golden. Come here! Get over! Why are you running? Why are you running? What did you walk in on, Fury Cures? You walked in on somebody making a horrible statement about Chicago style pizza. Which way is this gonna go? Ah! Damn it! Milwaukee is thin cracker crust, light on sauce, but lots of cheese and toppings. Okay. I mean, I guess I can... Oh, God! I mean, look, pizza's pizza. I love pizza, but if I had to pick one specific type of pizza, Chicago style, hands down, best. When the healthcare official beats you, I'll take 5, please. Yes! Get smacked, you know. It's like sometimes, so we were talking about IVs. Sometimes when you're going to start an IV, you just gotta grab them by the arm a little bit, put the tourniquet on, and just give it a few little... Sometimes you gotta smack that vein a few times to get it to plump up. Deep dish pizza so good. So good. You just wanted to touch the flops? No touch the flops. Oh my god. Ah! Ah! Oh god, hurry. Go, 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 go. Can you explain the feeling of an IV insertion? Big pinch and that's it. You just feel the pinch of the needle is pretty much what you're gonna feel. Ah! Oh! So close. That's so close. Ah! Cheese stuffed crust. It hits good. It depends. If it's good cheese, it does. Gotta be the good cheese, though. Oops. Let's go this way. There we go. Saber, thanks for the follow. Welcome to Bobby Flock. Welcome in. Ah! Chicago style is, if you like drinking marinara sauce and cheese from a dough, hey, it's so much better than that. How dare you even compare it to that? Okay, good. It won't blow up my jammer. Hi, take care. Sleep well. Beep, beep, beep. Beep, 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 beep.
Beep, beep, I'm a sheep. I said beep, beep, I'm a sheep. Beep, beep, I'm a sheep. I said beep, beep, I'm a sheep.
Sauce is the best part of the pizza.
Dude, Russell Fluff coming with a tier 1 sub for 4 freaking months. Yes, I agree. Sauce is actually, I like the cheese the best, but sauce is pretty damn good. Thanks for the sorry. Russell Fluff, you're still covered under collar care from the flops to the beans. And the marinara sauce. I got you covered. I was a little squeamish about the different needles, but I was okay. Thank you for the class. I'm glad that you enjoyed it, Rob. I hope, did you guys learn something today during our lecture? Did you learn, did you feel like you learned something about different types of needles and why we use them and why we do them? Or did you just like seeing pointy things? There we go. Easy! I've only had one saline drip and I got the feeling I was getting eternally cold. The nice nurse, yes, it'll make you, so when we put people on saline, when we do like a drip, it's colder, the medication is colder than body temperature, so some people get this sensation of like a cold feeling up their arm. I learned, thank you. I'm glad you learned. Dude, all I ever want is for people to learn when they come to my classes. If I could make, if you come to my class and for whatever reason you end up in a hospital and something that I taught you helps you to understand what's going on a little bit better, that makes me happy. That means that my job is done. Falco, boom! Boom! You got a star! Thanks! I am a star! Ah! Chicago style pizza is what I will have if I can't find thin based stone baked pizza. I love the lecture. I have anxiety about it. Hopefully the next time you have to face a needle or have to deal with a needle for any reason, you at least have an understanding of what's going to happen. I learned a lot in your class. Today I learned the best place to sit. I can sleep without you. Vex, do it! Unbelievable, Vexcra! That not only would you fall asleep in my class, but you would have the balls to tell me about it? I can't even be mad. I'm actually kind of impressed. Takes a lot of bravery, to be honest. I had a pizza order that was just crust and sauce. Was that like the nun pizza left beef? Delicious. The short deep dish fails the first step of cheese, always goes on the bottom. Cheese on the bottom, sauce on top, ingredients in the
Here,
middle.
those who are worthy may seek the counsel of my blessed messengers. But their wisdom shall
Hello
not
there,
be given
disembodied
easily,
voice again.
for your accomplishments must be your own.
Oh man, they're gonna make me use all of my cunning for this. Ah! Cinder is divine taco. God is speaking to him. Oh God, get out of my head! Get out of my freaking head! Oh God! Can I jump up and grab this? I think I can. Now wait, I can.
Needed to
Okay.
cover my beans and flops. Cinder 7 flop.
Dude, Banjo Beats coming with the tier 1 sub for 2 freaking months. Banjo Beats, you're covered under collar care from the Banjo to the Beats. I got you covered. Thanks for the continued sub. Needles to cover my beans and flops. We don't stick needles in beans.
Woohoo! Shazbot!
Jazzbot. Shazbot. Cute face ring, thanks.
I might get a deep dish before I leave eel tomorrow.
Dude, get me some, please. Thanks for the 1 bit. Thanks for making Tux dance. Wizard, Wizzy. Wizzy. What's up? Okay, I think I gotta bring that. Wait, what? Ah! Oh, here, let's do this. Bye-bye, ball. Alright. You can make this, we'll figure this out, yeah. Oh. Got an idea. Wait. Can I do this? Oh, I can just take it like that. I can just do this. Okay. Cool. Why not? Why won't any place let me order pizza without pizza as a topping? I think that kind of defeats the purpose, doesn't it? Dude, Bunny, coming out with the... Wait, why did it go off? What the hell? Bunny, I see you with the tier 2 sub for 2 months, but it didn't want to go off. Let me see if I can replay it. Hold on. There it goes. Dude, Bunny coming in with a tier 1 sub for 2 freaking months. Dude, a tier 2. Enjoy your... What do we get? The coffee emote or the sheep? I think it's coffee. Also, if you guys are still coming in from Tristan's stream, we have all these better Twitch TV emotes that are free to use for the channel. Use them. Enjoy them. Those are not squeaky toys. No, I want the ball. I want to play with the ball. Give me the ball. Am I missing a jammer somewhere? get him out of there. Beep, 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 beep. Alright, hold on. We'll figure this out. I missed something. Axel Holt, hey! Or Axel Holt, sorry. What's up? Welcome in. Kenneth, thanks for the follow. Welcome to Floppy Flock. Welcome in. The Adventures of Barrow. Thanks for the follow. Welcome to Floppy Flock. Welcome in. Welcome in, guys. What's up? We're trying to play Talos Principle. I feel like I'm missing. I'm missing a jammer somewhere. What do you mean try? I'm trying! Vextra! You do not don't play with my emotions like that. Either you throw the ball or you don't. There's no half faking it like that. That is like dog rule number 1. So mean. Oh God! Okay. Could I get the first ball to follow up? Maybe? I don't think he comes up this far, does he? He might. Oh God, I'm still angry. Oh, okay. He will go up there. Oh God, I gotta get up there, I gotta get up there! Mastermind,
On 4 months of collie care from Best TMS Collie, Purple Heart, Heart, Purple Heart, Heart.
Dude, Mastermind coming with the Twitch Prime sub for 4 freaking months! Mastermind, you're covered under collie care from the mind to the brain. I got you covered. Jeez, 4 months. 4 months of collie care, 4 months of disappointing coverage. You're welcome. Hey, babe. Boop, boop. Beep, beep, beep. Beep, beep. Did I get all of them? Yeah, and I got the star. I missed another star on there, but that's okay. The regular healthcare then? Pretty much. First red piece, hooray! Alright, we got more yellow pieces in here. Beep, beep.
These worlds, and we within them, are made of words.
Beep, beep.
Hidden words, invisible to you, yet part of all things. We are a story.
Beep, beep.
Your actions give life to the story, and the story gives meaning to your life.
Beep, 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 beep. Beep, beep. Download profile, sure. What do I get to name it? Congratulations, your news account has been registered. Would you like to see the details? Display conflicts. Conflicts. User provided a particular account of personhood but was uncomfortable with its implications. User sought to maximize both liberty and quality of life, but these ideals are incompatible. What? How are they incompatible? Who says those two are incompatible? User denied moral authority but defended moral claims. Interesting. Play account privileges. You paid only 5% of my hospital visit? Damn right. Basic account privileges only. Due to outstanding notes on your account and despite displaying many of the characteristics of being a person, you cannot be granted admin status at this time. In the meantime, please enjoy the basic account. It's saying I'm not a person. Thank you. Psychological profile. Let's see what they think about me. Is Chicago style pizza where if Chicago style pizza were good, why isn't it everywhere? Because no one knows how to make it as good as we do. That's why. You may already be criticizing your own performance, but it's clear you understand how the world of ideas affects you, even if you are sometimes wary with the realities and allow your preferences to dictate your beliefs. You have a great deal of unused capacity which you have not turned to your advantage. Disciplined and self-controlled outside, you tend to be worrisome and insecure inside, but you pride yourself with an independent you pride yourself as an independent thinker and do not accept others' statements without satisfactory proof. It's scary kind of how accurate that is. Isn't it the first time you've seen Flyzik's model conversion? It looks so good. Yeah, he did an awesome job on it. Throw money at Flyzik, please. Go throw money at Flyzik if you can. You got 5%? They tell me I owe Floppy Care 50%. Whoa, what the hell? What?
Behold, I am Elohim, and I speak unto the darkness. Be gone.
What?
Excess data cleared.
Should I be concerned? Why do they have all these ruins if you're not supposed to... Oh, hey, there's a person. If you're not supposed to, like, follow them. Do anything with them. Where you going, buddy? Snowy White Fox, hey, what's up? Okay, bye. What does that mean? Have I not unlocked these yet? I'm doing well, how are you? What does that mean? What does that mean? Did I go too far? I can unlock them in the temple. Okay, so I gotta go back to the temple. Sleep well, buddy. Thanks for stopping by. I appreciate it. You've unlocked item. Can I have it? Item
There
get.
is much that you may learn in the halls of my temples, for there is much that you do not know. That is why
You guys just call me
I'm a child.
stupid?
But children are made to learn, and in time they come to have dominion over the lands of their home.
Did he just
So
call me
it shall
stupid?
be with you and your generations.
First item, let's go! Yes! Spam Cinder 7 hype! Hype! Baby man! I ain't no baby man! Cinder is smart, I'm actually kind of stupid. Alright, now we can do it. Thank you. I like laser puzzles. Laser puzzles are so fun. Oh wait, oops, okay, put there and... Yes! Puzzle piece, get! You saw the collie loading in the gym. That poor dog. That poor dog tried so hard. Ah! Ah! It's burning me! Ah! Can I also do, but I can do multiple? Ooh. Okay. Okay, okay, okay. Puzzle piece get! Let's go! Let's freaking go! Puzzle piece get! He's died as he lived, getting burned by lasers. Yes! I want to go out that way! Just burn me! Don't cross the streams. Oh, okay, so they can't be crossed. Alright, 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 alright. Okay, so I can't do that. I get 2 of these? I do. The gears are churning. The gears are churning, guys! I'm trying, I'm thinking. Hold on. Don't tell me, don't tell me. I'm gonna figure this out. Okay. Have I played The Witness? I have. I never beat it though. I might go back and play it because I actually really enjoyed that game. The Witness was really cool. I want that puzzle piece! Done. Yes! Guys, Cinderpog clap. Cinderpog clap. It looks so good. Ah, okay. Did it! Done! Easy!
Jazzbot!
Jazzbot! When we get in tucks in for facts, whenever he feels like doing it. I'm not gonna pressure him. I've presented my idea. Whether or not he would like to do it, it's gonna be up for him to decide.
The answer that came to me again and again was play. Every human society in recorded history has games. We don't just solve problems out of necessity. We do it for fun. Even as adults. Leave a human being alone with a knotted rope, and they will unravel it.
Oops. Wait, no, I want to listen to that. You can play again if you go to your archives. How do you do that? How do you do that? Like where you save the computer files you find. You forgot! Oh! That's okay. I'm not super interested in the story. New cinder. Hey, don't pick. Stop picking my nose. Those are my boogers. You must consider these riddles, the Sphinx said, and tell me the riddle that it did not reveal. The Sphinx smiled, the gears in her head and her jaw creaking, her teeth. I don't know. Does any of this matter? What is your favorite bandana? This one. Watching Cinder and playing Magic the Gathering? Oh, I never got into Magic the Gathering. It always seemed so daunting. The more I converse with these terminals, the more I wonder what role they play in this contraption. How do you tell friend from foe with no obvious line drawn between the two? Hey guys, there's a sheep! Look at sheep! 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 Hey, get out of my freaking nose! Why do you have fish on your bandana? Ah. When I first got my fursuit, I went to go look for fabrics that I liked, and this one stood out, and it worked. It just worked great. I like the colors. I think it looks cute. The fish don't have any symbolic value or meaning behind it. I just thought it looked cute. Alright, so I'm gonna have to unlock the box, aren't I? Yes. Okay. Excuse me.
I was in school when I first read about the Talos principle. I think it disturbed me at the time. Made me hyper-aware of my body as a physical object, the material reality of the brain. Ideas that made me uncomfortable at first, but I think in the long run, it helped me understand how frail human beings are and how precious.
There we are, frail.
It's not a comforting way of thinking about the world.
Thank you for the blessings. Thank you. Thank you.
And lie to myself.
What kind of metal bands do you listen to? I like progressive metal. But like, you know, obvious, like the most encompassing way to like Dream Theater, Haken, Porcupine Tree, Devin Townsend is freaking amazing. Like Between the Buried and Me, Opeth, those types of bands. Give me that progressive. You made him sneeze. Yeah, 'cause you guys kept poking my damn nose. I have now unlocked Q. Give me that cube. Give me that cube. Give me that cube. I said, give me that freaking cube. Cube. Did you hear me say I like prog metal? You did. You did. You ever listen to, hey, Mastermind, you ever listen to Beardfish? Swedish band, I think. Oh, they're not around anymore, but they're like, I love me some Beardfish. You guys are awesome. I like the weird kind of goofy stuff. I think I like the cheesiness. It's entertaining to me. You'll be needing a special device to solve this one. Well, hey, guess what, Fox? I got it. Primus, yes! My name is Mud. I do Primus. There, what a weird freaking band. Guys, we got a cube. Ooh, I can jump on them. Can I cheese the system? Hold on. Oh, you can't. Ever listened to Ruskaja? Russian? I have not. What if I do this? Ah! No cheating? I was trying! I like your Cheeto lock tweet. Oh, yeah. The one with the Cheeto holding it open. Yeah. Slapped up inside the cranium with my aluminum baseball bat. My name is Mud. Okay, it doesn't work, it doesn't work, it doesn't work. Haken is really worth a listen, 100%, absolutely. If you like any type of progressive metal, go listen to Haken. Just put on Visions and listen to it all the way through, the entire album. It's fantastic. Affinity is also amazing. Ah, so good. So good. Their new album's pretty good. Virus is good. I enjoyed it. Got it. Puzzle piece get! Virus is so good. I like it. So I really enjoy it, but I mean, Affinity is like, So right before lockdown hit here in America, the last thing I did was I went to a Haken concert, and they played Affinity in its entirety, as well as a few extra songs afterwards, and it was absolutely fantastic. Oh my god, it was so good. It was so good. Getting to hear Affinity live and getting to hear like Earthrise live, so good. Oh wait, is this the red? Is this? Oh, I don't want to do that one yet. I don't want to do that one yet. Do green. If you haven't listened to Wishbone Ash, you should. They're good. Okay, I'll listen to them. I'll give them a listen to. Contortionist, Haken, and Devin Townsend. That sounds amazing. I think that I saw Contortionist with Devin Townsend. No, wait, who were they with? They were with. No, Contortionist was with Haken. So that's right. So Contortionist opened up for Haken. It was Jason Key, Contortionist, and then Haken. I wanted to go see Haken and Devin Townsend together because that would have been freaking awesome. But it didn't work out that way. I'm not a big Contortionist fan. I never really got into them, if I'm being honest. They're okay. Ah. I saw Devin Townsend and Fear Factory. I've actually never really listened to Fear Factory before. Job for a Cowboy. That's a band I haven't heard of in a while. Let me in! Bramstein? I don't really. I'm not the biggest fan of them. They're okay. Nothing against their music, it's just not my favorite. Oh my god, come on! Oh, you little piece of junk. Okay. Screw you! Ow! Screw you, dude! I really like the sound of those computers. I think it's nice. I'd recommend listening to Ministry. What about Ghost? Anybody listen to Ghost BC? Yeah. Okay, I can't get too close. I wanted to see how close I could get. Can I go underneath it? Oh, I can. But if I go this way, it's gonna shoot me. Okay. Head goes for sub alerts. Watch her now and then. They're pretty good. They're like I like them. Oh yeah, get them. Go get them. Yes. Okay, now I can do that. What happens if I open up that one? Maybe that's where the puzzle piece is. And now we wait. Weird Al? Yeah, I mean, I know, I've listened to this song. I know Weird Al. Listened to his music before. Get him, get him, get him, yes! Yeah, stupid thing. Oh, hey, a star. Star, get! Whoops. Oh, wait. Done! I think that's everything on this map. I have no idea what's going on. Do you? Tater Tots? I do not. Oh, that's, I know who that is. Wait, are these friends who put these on here? Beep, 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 beep. Oh god, you know what? Stretch! Oh. It does pull a name from your Steam friends. Okay. I was like, I know that name. That's a friend of mine.
Long ago, I shaped these lands according to the purpose of the hidden words. Thus, all things have meaning, where before was only chaos. Know that, and have faith.
Okay. Maybe you say disembodied voice of my dreams. Hold on a second, guys. I run to the bathroom real quick. Alright. Sorry about that. I had to blow my nose. I had a boogie. I had a boogie sticking out because you guys were picking it so damn much it made me get a booger. Emergency transmission. Hello again. It seems you're still encountering a problem. Have you completed the standard troubleshooting procedure? Email network. Mail application requires network access. Figure to administrators. Error! Oh god, okay. Apparently, a basic function. Would you like to undertake the certification program? Sure. Your issues with denial will be appended to your user profile. Further attempt. What the hell's going on? I don't know what's going on. Wait. Where's the computer? I hear one. Is it up there, maybe? No, but stop booping my nose, damn it! Stop it! What else who knows this for? What else who knows this for? Smelling? Duh. That turns that one off. Hell yeah! Oh god! Ah! Got it, okay. I wasn't panicked. Why were you guys panicking? Dude, chat, why were you guys panicking? I was not, no one, who was panicking? Nobody was panicking. The environment in this game is so similar to Oblivion. It makes me think of The Witness. And now I really want to play The Witness again. I'll go this way. This is actually about the people who made Serious Sam. Really? Ah, I didn't know that. Sure, I'll need that for something. Oh, there's another one. Doesn't help me. Six a.m. Doing up so early. Oh, I was standing in it. Oops. Huh. I got an idea. Ah, cube, yes. Look at that. We got it. Got it, we got it, we got it! Yes! Easy. Freaking easy! Oh wait, there's more. Now we got it. Easy! Some guy named BB Wolf is here. He says he wants to inspect the sheep. Should I let him in? Does he have credentials? Ask him for his credentials. Beep, beep. Beep, beep. Beep, beep. I don't know what any of this is. A simple principle. Though Stratton himself never used the term, his remark about the inescapable materiality of life. This is so dry. I don't want to read this. It's all dry. None of this interests me. I just want to do puzzles. Give me a thinly veiled story and puzzles. That's all I want. Easy to follow. Maybe a small twist at the end, but something easy to digest. Don't make me read Greek mythology and this, philosophy. I don't want to do that. I just want to play a game and do puzzles. Like, I'm not trying to take like an ethics class or a morality class here. I'm trying to play a puzzle game. What's that? Oh, okay. Huh. Not as dry as your tongue. Hydrate? Okay, fine, I'll hydrate. Ethics class, easy A. You say that. I had to take a part of nursing was taking like ethics stuff, and it's some of the ethical dilemmas they put you in are pretty tough, right? Like some of them are really, really tough. All right, hold on, guys. We got this. We're big brained. How can I sacrifice one of these while getting the same effect? I like this cute collie. I've been watching the JFK clone hunt. Wait, like, okay, I'll take it. I'll take like. Mark. God damn it! What? I'll figure this out. Hold on. Hold on. Don't tell me I don't want to know. Ah. Tricky, tricky. What's up here? Nothing. In the context of medical education, I can imagine such classes would be much harder. Okay, you think of like the classical ethical and moral dilemma, right? Think of like, okay, a car accident happens. A drunk driver with a history of multiple DUIs slams into a minivan with a mother and 2 kids, right? All 4 of them present to the emergency department at the same time. The drunk driver is the most critical of those patients. He is the one who receives treatment first. Even though it was his fault for the accident because he was a drunk driver. And even though he potentially could have hurt those children. But if he is the most critical, you need to treat him first. It's stuff like that. I mean, it gets way harder than that. When we talk about like research stuff. Damn it! Figure this out. What am I missing? What am I missing? What am I missing? I need that open for this laser to work. Do I though? I don't. No, I don't need it. But I can't cross streams. But I can do this. Oops. Oh, damn it, I locked that one in there. Wait, what? What did I do? What did I do? I figured out what I need to do, but I screwed it up. Alright, hold on, let me restart the puzzle. I know what I need to do now. I understand. Wait, what? Hold X. Cool, thank you. Hyper Weasel, thanks for the follow. Welcome to Fobby Flock. Welcome in. Oops, what am I doing? I watched a video yesterday on Harry Harlow, who worked in Madison and his psychology experience. I'm sure they, dude, some of those psych experiments are pretty screwed up. Ah! Got it. Okay, figured it out. Maybe? Oh god. Okay, maybe I don't. Don't tell me. If I close that, that goes away. Yes. I love ambience puzzles like this so much. I do too. I really do. I missed your last stream because I was on one-day trip to south of West Australia doing stuff for my uncle. Hopefully it wasn't too hot. Hopefully there were no crazy, you know, like massive spiders and stuff like you guys have. But I feel like this is close to the right way. Is there a way? I need one more. I need to do this in one less. I need to get this opened up with one less of these, which I'm already only using 2 of them. Ah! So many lasers. Got it. I got an idea. You have 621 collie coins? Nice. E621. Dr. Plagueine, thanks for the follow. Welcome to Floppy Flock. Welcome in. MSG! Dude, MSG is delicious. Hard puzzle? Yeah, I'm working on it. I'm working on it. So here's my thinking. I have to do one of two things. Either I need to pipe this red one through this gate over here to keep this one open. Or I need to run the blue one back. But I'm trying to figure out how I could possibly send this into here and then over there to connect to open up this gate so I can get the blue laser out. Or I can run the blue laser back this way and like up here and cross streams and go that way. But then I need one more laser. The European Union MSG has a number E in front of it. Yeah, it's E621. Come on! It's Bush League! Bush League furry stuff, come on! You pooped again? You pooed again? Maybe... Bailey, I don't want to know about your poop. I don't really want to know about it. Keep that to yourself. I'm not getting paid. I don't want to know. Oh my god, okay. These, I feel like I can't do anything with these. Uncle Roger say MSG is king of flavor. So much flavor. What is poop? It's waste. That's why it smells. A lot of bacteria in your gut. Should have come around for the GI lecture. You would have learned all about it. Guys. Okay, I have a question. The people who beat this game. Are one of my two ideas correct? I either need to pipe the red one in through this hole to open up this door, or I need to pipe the blue one back out. I need to bring the blue one out here, cross it over, then put it. That's why there's these raised platforms. One of those is correct. Okay, I'm gonna assume it's gonna be sending... Now herein lies the problem. I'm out of reflectors now. Unless. Huh. Oh, got it. Okay. Yes! Oh, that one took way longer than I wanted it to. Some of the messages that existed when I first came in have vanished. Others have appeared. How many others like me have wandered these paths? I'm still here. It seems we're all here at once, and not at all. Sorry, this is not very much help. It is. Okay. The sooner you accept that we will all be here forever, the sooner you'll find enlightenment. Bailey, what are you talking about? What are you talking about there? I don't know what you're doing. What are you doing? What? Oh. Where is there a cube? What, Pepe the Frog? I mean, I know of Pepe the Frog, but I don't know what you're doing. Yeah. Why does that open up if I don't need to utilize it? Can the beams of light cross? No, they cannot. They cancel each other out if they do. Damn it! As far as I know, these are the only ones that I have. Yes. I don't see anything else in here. They don't normally hide things from you either, so they've not made anything to show that they hide objects from you. Assuming I gotta put one of those on here. So I know it needs to be done. Can the stage reflect more than one light? It doesn't look like it. There's a reason why this. There's a reason there's something I can do here. I just gotta figure out what it is. Oh, almost. Okay. Now! Okay. No! What the hell? Okay, right idea. Just poor execution. If I take that, all this collapses. Just like that. I think I got the right idea. I know I have the right idea. Oh, duh. Now I got it. Okay. I always figured I can do multiples. Got it. Okay. Yes! Is that all the puzzles for this level? Beep, 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 beep. Beep, beep, beep. More lasers. That looks ominous. What's in here?
There are mysteries in my garden, hidden roads and secret gates. If you dedicate yourself to understanding them, you may join the host of messengers.
Oh, I can unlock this. Does computer beeps remind you of Among Us? Beep, beep, beep. Beep, beep.
When I was in 9th grade, my parents took me to Pompeii. At first, I was amazed by the feeling of walking through an ancient city. But then I suddenly got scared. I realized that I was walking through a real place where real people had lived, people like myself, with mothers and fathers and lives and hopes and dreams. And now it was all gone forever. I ran to my father, crying, and
I'm not
told him about
sus.
this. And he said, I remember so clearly, he said, yes, but we are here. So long as there are people in the streets, the past isn't really gone.
Have a good one, Banjo Beats. Take care. Hopefully work goes well for you. Cinder is I'm not sus, and I'm definitely not sub. Okay, well, maybe, but... It doesn't say sub, well, you know, sometimes you gotta tell it like it is. Oops. No! Peace get! Going to jail? No! No jail! I've done my time. Oh, that was easy. Well, that was easy. May I pet the ears? I don't know. Why do you want to pet them so much? Yeah, sure, go ahead. Ba-da-ba. Oh, the ambient music is so nice. Because they're cute? Oh, okay, fine. I'll give you that. Gives coffee and flutes? Yes! Give me that coffee! Yes, yes, yes! I want that coffee! Give me that Kofifi! Will you stop picking my nose, goddammit? Oh, let me do that one first. Stop it! Get out of my nose! You're gonna make it bleed! Oh my god, we almost did this. What are we missing? What are we missing? That's coming out to here and doing that. That opens up that. What are we missing? What are we missing? What are we missing? Greenie, hey, what's up? Welcome in. Hope you're well. Thanks for stopping by. Wasn't there another jammer somewhere? Somewhere. Was there? Nothing in here. No. How hard is it to say greenie? What? So, I gotta get the jammer on this side, maybe? Maybe? I'm missing something. Missing something. And if you look around, go ahead. Enjoy enjoy your stay. Okay, okay, okay. Alright, alright, alright. We're just taking the screw life on none. They make a nursing student do it? Damn right. No, I think I've screwed it up. I need this over here. Guys, Tux is home. Tux! Ooh, what'd you get me? Tux brought me coffee and cake. Oh my god. Thank you, babe. Ooh, he brought me coffee. Hey, wait, babe. Tux. Tux. Can you give me a fork? Thank you. They should be in the dishwasher. Ooh, he got me coffee and a cake. Oh. Some brain food for this puzzle. Thank you, babe. Yes! Cake! Oh. I literally want to have my cake and eat it too. I definitely do. Kodai, hey! Who's Tux? Tux is my my partner, boyfriend, partner. I don't know. I always prefer the term partner, but personal preference, I guess. I think we beat it. Yes! We did it. We did it. Big freaking brain! We got me just like it's like a plain latte. Oh, so good. Guys, 2 more puzzles. 2 more puzzles. Then I'm done for the day. 2 more. 2 more! Well, let me get some cake. Hold on, let me get my cake. You're gonna make me coffee, aren't you? You're gonna make me make coffee? Yes, go get coffee. If you have coffee available, go eat it. Or drink it, rather. You don't eat coffee, you drink coffee. These sigils are becoming harder to reach. I dread what the next temple holds in store. At the end, what? Eternal life? Gotta be another way. Which one is this, classroom or Talos? Both? We're flexing our brains! Ah, okay. Okay, settle. Alright. Let me eat more cake while I think about it. I'm back with truck parts. Captain Snuggly Cactus, dude, what's up? Ooh. Get some of that cake. I think it's particularly stinging when we acquire something we want, but lack the means to effectively make use of it. Mister, thanks for the follow. Welcome to Floppy Flock. A Bonkard Bogo. Shabongo, thanks for the follow. Welcome to Floppy Flock. Sorry, I'm eating cake. Okay. How goes the puzzles? Pretty good. I genuinely enjoy this game. It's been a lot of fun. Oh. That's good to know. That's there. He's good. Alright guys, last one. Last one till tomorrow. knew that was gonna happen. Electro Ball needs hugs too. Yeah, he just needs hugs. You just gotta be nice to him. Kens, thanks for the follow. Welcome to Floppy Flock. Welcome in. Yoda Slippers, thanks for the follow. Welcome to Floppy Flock. Welcome in. What's up, guys? Alright, so we got red. X-Wing, thanks for the follow. Welcome to Floppy Flock. Welcome in. The only thing we can do, but it gets interrupted. Oh my god! Oh, what if I... I feel like, am I missing something? Screw you! Wait, what if I like... Can I stop it? I can't. I personally... Oh, it does kill you. Oops! Oh my god! What am I missing here? I had it already? Hey. Like, I get that I can do that, but I only have one of those. That doesn't help me. You spilled water? Why did you spill water all over your kitchen? How does that help you? I'll ask for help. Let me figure this out. Hold on. I will figure this out. Oh, is that a hint? Oh. Duh. Yes! Where's the blue laser come into play, though? Oh, well, we did it. Beep, beep. Beep, beep. Beep, 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 beep.
Rejoice, child, for you have fulfilled all your tasks in this land. You have conquered all its guardians
Yes!
and solved all its mysteries.
Yes!
Thus you are appointed its master.
Ha!
Do with it as you will.
Tom Cinder, let's go! Alright, well, I don't know how to get in there, but that doesn't look important. And then there's this over here. Can I have enough for this now? Don't have enough sigils. I need... How many stars do I need? 1, 2, 3, 4, 5, 6, 7, 8 stars?
You have proven yourself worthy, child.
Yes, I am
and
worthy.
This gate shall be forever open to you. Seek now the other worlds I have given you, that you may attain even greater mastery and bring glory to your kind.
Okay.
But remember,
Okay.
you must not ascend the great tower, for it shall bring death and the end of your generations.
Yeah, so that sounds like something that I'm gonna do. Oh, there's a lot of puzzles in here. Alright, well I feel like this is a good place to stop. Time being. Nothing? Beep, 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 beep. Alright guys, we gotta find someone to raid. Do you know Serious Sam? I know of the game, yeah. Beep, 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 beep. Let me see who's on. Who can we raid? Oh, excuse me. Oh, that one gave me like, oh, gave me goosebumps. Oh, stretch. Oh, thank you for the blessings. Who do you guys want to raid? Who do you guys want to raid? Keith's playing Valorant. Vince is playing Dark Souls 3. Lumi's playing Dead by Daylight. Viexe, thanks for the follow. Welcome to Follow Me Flock. Welcome in. Beta's just chatting. Go. North Dog's playing Undertale. Karen Crimson's playing Banjo Kazooie. You guys want to go watch Vince play Dark Souls? Pineapple Fox playing what? Dark Pictures? What's Dark Pictures? I don't really care for that game. Kind of boring. You guys want to go raid Vince? You guys want to watch Vince play Dark Souls? Want to watch him die in Dark Souls? Maybe? I know you do! Alright, let's do it. That's what I'm gonna do. Alright. There's our raid message. Hot for teacher. Guys, I'll be back tomorrow. Probably, most likely, maybe, most likely, sure, back tomorrow, maybe. I'll be back. We'll keep playing more Talos Principle. I really enjoy this game. It's fun. Okay. You guys know what time it is. Let's hit up the discharge desk. Thanks for the follows. Thanks for the host. Thanks for the subs. Thanks for the bits. You guys are freaking awesome, as always. Guys, I hope you learned something today. Tomorrow, we're going to do more Talos Principle, and I'll come up with a lecture of some kind. I'll figure it out. I don't know. Alright, guys. Spam that hot for teacher. If you're not subbed, go ahead and get the emote. Use the emote points to unlock the emote. Do it now. Quick. Hurry. Guys, thanks for hanging out. I appreciate it. I'll see you guys tomorrow, okay? Until then, bye.
Thorn 28 Moonblaze Wolf, Fluffy Bear, Fergie.